Nigeria's President Bola Tinubu recently said his administration is prioritizing and improving health sector through massive investments and an increased allocation of funds to the sector in the proposed 2024 budget. He also appeals to Nigerian health workers practicing abroad to sacrifice their time to return home and serve their people. Describing health as a fundamental human right, Tinubu announced plans for a comprehensive revamp of physical infrastructure, equipment, and the retraining of frontline health workers starting in 2024. And now, Kelvin Ossai, a registered nurse in the United Kingdom, joins me for more on this. Thank you so much, Kelvin, for joining us.
Thank you, Blessing. Nice to see you.
My pleasure. It's nice to have you join us on the news. Now, Kelvin, as a medic abroad, what are your initial thoughts on President Tinubu's appeal for Nigerian doctors overseas to sacrifice their time, in his words, to return home?
For me, I have no thoughts on this because there are no things on ground. So if you're making an appeal, like it is an appeal, it's not compulsory, order or something. So I feel there should be things on ground. If we look at the health sector from the south to the east to the north of Nigeria, you realize that there's a lot of decadence, a lot of deterioration in the health sector. I trained in the University of Port Harcourt, teaching hospital, and you will realize that in the accident and emergency of most of the teaching hospitals, people are struggling, fighting with mosquitoes, fighting with no lights, and people are having to buy things for themselves. This is not something someone abroad would want to come and meet. If we look at the health sectors in the foreign countries like the UK, US, Canada, Australia, there are functioning ambulances, there are functioning health sectors. There is a process, there is a standard of practice. We do not have that in Nigeria. So I have no thoughts because personally for me, I don't think it would be fair for me, in fact, to my family, that I will come back to meet such situation. So my thoughts are simple. The system should be put in place first before the appeal.
Right. Now, Kelvin, in your experience, what factors typically influence medical professionals working abroad? And how do you think that President Tinubu's plea addresses these factors? Now, we hear that lots of times they decry, lack of pay, poor standard of living, and then they have to go abroad to seek greener pastures. Does this plea answer these quests?
Thank you for the question. A plea does not put food on the table. That is one simple answer. So if you're pleading and saying, oh, if you're pleading to someone, oh, please, you should also plead to their landlord and to the people who are kidnapping doctors and nurses. Statistically, doctors and nurses have been targeted for kidnap in Nigeria for the past 5 to 10 years now, and nothing has been done about it. Also, if we look at the pay for nurses and doctors, I remember as a registered nurse in Nigeria, my first salary was 25,000 naira. And I know so many nurses who earn 20,000 and some doctors who have to do 3 or 4 jobs before they can even make up to 100,000 or 150,000. So you have to finish a night shift here before you go to another place to do a morning shift. And that is not the kind of life we want to live. And you also realize that there is no equipment in place for you to practice. Most of the things you read in school, the things you studied, you do not see them on ground. And that is the big problem. Now you see a patient, you assess them, you see this is the problem, but then it's very heartbreaking when you have to send these patients to go and buy hand gloves, to go and buy IV fluid, to go and buy tourniquet, to go and buy the injection syringe that you use to treat them. That is not the kind of practice. So in terms of the factors that motivate health workers to move abroad, I would say, first of all, the pay. If you're in the UK or US or Canada, any of the countries you practice, you realize that your salaries come as at when due. As we speak, this is December, most of the health workers in the foreign countries I've just mentioned above may have or should be expecting their salary in the next few days. You are not owed your salary. That is point number one. Number two, you're working in a standard practice. I work in an accident and emergency as a registered nurse in A&E. And one of the things that make the practice very sweet and pleasing is when you see a patient, you request for an X-ray. The X-ray is done within 10 to 30 minutes. You also request for, if you feel this person has a bleeding in their brain, I request for a CT scan. The CT is done. If a patient is brought in for maybe queried stroke, you have been informed that the ambulance is bringing a patient, and you already prepared. You have your ECG ready, you have your stroke nurse, stroke team ready, you have everything. The stroke consultant is there. And not when you come and the consultant or the facility are not there. The CT scan will be done, and within the next 30 minutes, you're sure, you know that this person is either having a brain bleed or not having a brain bleed. You know the course of treatment. But this is not what we have in Nigeria. You may do a CT scan, or you're unwell and you go to a hospital, they'll write a CT scan for you. You have to go to another place to do a CT scan. Most of our hospitals, tertiary hospitals, primary healthcare centers are not equipped for purpose. And this is the problem. This is why most people are leaving. You do not want to finish studies, your medical school or nursing school or whatever healthcare line you practice. You don't want to finish and then start, counting money for patients to go and buy. Oh, madam, take this one. Go that pharmacy for across the road. You will not get the medication for the hospital. Will not get IV fluid. Will not get glove. These are the problems. So this is why a lot of people leave. And then also, like I mentioned, kidnapping. Doctors and nurses have been targeted for kidnap in the recent years, and nothing was done about it. People are leaving. You do not, even if you're working in a place where you are being paid well, you do not want to be targeted by kidnaps and unknown, gunmen. These are some of the issues. Then we talk about the other infrastructures, bad roads, bad environments, and a lot of other factors. So I feel the government should target solving these factors. Health workers went on strike a few months back. Nothing was done. No feedback was given. Nothing was done. Also, in fact, a lot of things have been going wrong. And if these things are not solved, health workers will not see a plea as anything. A plea cannot put food on the table of any doctor, nurse, or pharmacist.
All right. These are indeed scarring experiences, and we really do hope that the government looks into that instead of, making a plea to Nigerian doctors or trained medical workers abroad to come back and serve their country. But anyways, thank you so much, Kelvin, for joining us on the news and sharing your thought on that development.
Thank you. Thank you, Blessing. It's nice to talk to you.
Nice talking to you too.